Hello, welcome to KK Women's and Children's Hospital Children's Emergency. So you have been told by the doctor that your child is diagnosed with urinary tract infection, or UTI in short, and you're wondering how did that happen to your child. UTI is commonly caused by germs that have gone into the urinary tract opening. It is not entirely the result of poor washing or inadequate changing of diaper. So when do we suspect UTI? In a pre-verbal child, symptoms are not specific and may include fever, irritability, crying, vomiting, diarrhea, or bad-smelling urine. On the other hand, a verbal child may complain of pain or burning sensation during urination, increase in urine frequency, urge to urinate after emptying the bladder, or lower abdominal pain along with fever. A urine test is required to diagnose UTI. Collecting urine sample in a baby who is not toilet trained is challenging. Hence, our nurses will place a urine bag in an attempt to collect the urine sample. A negative result from the urine sample is good enough to prove that it is not UTI. However, if there is suspicion of UTI from the urine test, we will then proceed to collect a midstream urine sample. Urine test with a midstream urine sample is the gold standard to diagnose urinary tract infection. The urine sample will be sent to the lab for microscopic examination and also culture to identify the bacteria causing the infection. So how is a midstream urine sample collected? First, your baby perineum is thoroughly cleaned. A clean bottle is then used to collect the sample when your baby passes urine. Sometimes, gentle rubbing may be applied to the lower abdomen to help stimulate urination. What if midstream urine collection is not possible? Your doctor may then suggest to collect the urine through bladder catheterization. This procedure involves inserting a catheter through the urinary opening into the bladder to drain the urine. The risks with the procedure include abrasion, discomfort, and infection. However, the risks are minimal. The perineum will be cleaned thoroughly to reduce risk of infection. Generous amount of lubricant containing painkiller will be applied to reduce the discomfort. So how do we treat UTI? Antibiotic is the mainstay of treatment. For young infants or children who are more unwell, hospital admission for intravenous antibiotic may be required. However, if your child is fit for discharge, the course of oral antibiotic ranging between 7 to 14 days will be used for treatment. So what to expect next? If fever is persistent despite 48 to 72 hours of oral antibiotics, please see a doctor for evaluation, as this can be a sign that the infection is not adequately treated. Hospital admission may be required for intravenous antibiotics. You may also receive phone call from the hospital to advise for change of antibiotic based on the final urine culture result. This is because bacterial detection through urine culture can take between 2 to 5 days. Most children make very good recovery. However, some children can have more than one episode of UTI in their lifetime. So if your child develops fever with no obvious cause in the future, please see a doctor to assess for possible UTI. Good hygiene practices, avoiding constipation, regular bladder emptying, and adequate fluid intake are some measures that may help to deter another episode of UTI. So does your child need a follow-up? Depending on the risk profile, some children may require a follow-up after the treatment is completed. During the follow-up, ultrasound scan of the urinary system may be performed, and subsequently a nuclear scan called DMSA at a later date to check for kidney scarring. In a very small group of patients, there may be kidney problems that require long-term follow-up with the pediatrician or nephrologist. Okay, this is the end of the video. Thank you for watching, and we hope the video has helped you to understand a bit more about UTI. Have a nice day and stay safe.